Dear viewers, the transcanal endoscopic approach to the facial nerve is a growing issue in endoscopic ear surgery. For instance, in recently developed endoscopic lateral skull-base surgery, tympanic and mastoid segments of facial nerve are needed to be manipulated in order to create wide passage to the internal auditory canal. To address such issue, this video will discuss two possible transcanal endoscopic approaches to the mastoid segment of facial nerve on cadaveric temporal bone. The mastoid segment of facial nerve is the most lateral part of facial nerve in the temporal bone, extending from the second genu to the stylomastoid foramen. It remains completely hidden behind the posterior canal wall. Based on the direction of dissection, this transcanal endoscopic approach can be divided into anterolateral and anteromedial approaches. In this axial CT scan view of left temporal bone, the green arrow is indicating the mastoid segment of facial nerve. The red arrow is indicating the anterolateral approach, where the dissection is directed from lateral to the medial direction, focusing the anterolateral side of the mastoid segment of facial nerve. The blue arrow is indicating the anteromedial approach, where the dissection is directed from medial to lateral direction, focusing the anteromedial side of the mastoid segment of facial nerve. In both approaches, the pyramidal eminence is the pivotal landmark. The pyramidal eminence is a robust bony projection medial to the facial recess situated in the retrotympanum. The stapedius tendon arises from its apex before inserting into the neck of stapes. The dissection is done mostly by transcanal drilling under the guidance of 0-degree endoscope. In this right ear, after elevation of tympanomeatal flap, we can see the tympanomastoid suture, cauda tympani nerve, incus, and stapes tendon. The moving red arrow beneath the tympanomastoid suture is indicating the initial dissection pathway to uncover the pyramidal eminence. After removal of the bone through this initial dissection, the pyramidal eminence is now clearly exposed. The green area on the posterior canal wall, vertically running from the base of pyramidal eminence towards the floor of external auditory canal, is indicating the presumed area of mastoid segment of facial nerve. A progressive dissection along this vertical plane from lateral to medial direction ultimately exposes the mastoid segment of facial nerve from genu to stylomastoid foramen. In this left ear, after elevation of tympanomeatal flap, we can see the tympanomastoid suture, incus, and stapes tendon. Moving blue arrow beneath the tympanomastoid suture is indicating the initial dissection pathway to uncover the pyramidal eminence. Before starting the next dissection, the cauda tympani nerve is needed to be transected. After removal of the bone Lateral to the facial recess, by this initial dissection, the pyramidal eminence is now clearly visible. The green area on the posterior canal wall, vertically running from the base of the pyramidal eminence towards the floor of the external auditory canal, is indicating the presumed area of mastoid segment of facial nerve. A progressive dissection along this vertical plane from medial to lateral direction ultimately exposes the mastoid segment of facial nerve. These two transcanal endoscopic approaches could successfully excavate the entire mastoid segment of facial nerve. Conservation of the cauda tympani nerve is the major differentiating point in between these two approaches. In anteromedial approach, the cauda tympani nerve is needed to be sacrificed for the sake of completing the required dissection, whereas in anterolateral approach, this nerve could be preserved successfully.